There is something fundamentally missing from the way we are raising pets today. And this is something that I have been exploring with various guests over the past few months. And it's been a very long time since I had Dr. Jeff Feinman on the Pet Parenting Reset podcast. And he recently came back on to do an episode for Pet Health Junkies. And I promise you, I do not put every Pet Health Junkies episode up on the Pet Parenting Reset. I don't do it. I really, truly take the ones that are like, wow. Once we got done recording, I was like, you know what? This is something that I want more people to hear. And this episode with Jeff Feinman is one of those episodes because we have lost sight of the fundamentals. And so many times people think diet, 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 diet. And yes, that is very true. But there are things alongside diet that we aren't thinking about and that we're missing. We've touched on some of them when I had Sidian on talking about clean water, when I had Jackie on talking about light therapy. And we're going to continue exploring this topic, but Dr. Jeff Feinman just put out a new book, which he will be talking about in this episode. And I bought the book because I am so excited to actually dig into these fundamentals that I truly think we're missing. It's really easy to get on here and talk about this food or that food and this supplement or that supplement. But what about the things that are actually bringing us back to nature? Now, yeah, sometimes our situations and circumstances are not allowing us to do that to the degree we wish we could. Somebody living in a high rise, for example. But there are other ways. Sometimes we might have to spend money to get back those things in our lives when our lives are not including them. For many of us, those things are free. For many of us, they are not, like clean water. For most of us, clean water is not free, which is a shame, but it is something that we have to think about. And so I think cutting through a lot of the noise with this supplement and that food and this and that and blah, 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 and let me buy this and let me buy that. How about we really take it back to basics? And that's kind of what this episode is with Dr. Jeff Feinman, which is why I decided to pull it over onto the Pet Parenting Reset. So I'm just going to go ahead and let you listen because I really think this is a conversation that we need to be having more often. Welcome to the Pet Parenting Reset podcast. If you're new here, my name is Jess, and this is a space where we talk about all things health span and quality of life for your pets and you too. I'm so excited that you're here. Let's dive in. Welcome back, Pet Health Junkies. First of all, let me welcome Pam and Janet with us today. Thank you for taking your time to come on and record this podcast today, which is going to be a really, really good one. I actually had the pleasure of interviewing Dr. Jeff Feinman on the Pet Parenting Reset a while back, and we have him back today to talk about all things holistic pet health and a new book that he has coming out. And welcome to Pet Health Junkies, Dr. Feinman. How are you doing today?
I'm doing the best I can do today, right now. So I'm doing great.
Yeah, no, I understand that.
Perfect.
So we have a ton of questions that we could get to today. I know we're not going to get to all of them today, and I want to make sure that Pam and Janet have plenty of time to ask any of the questions that they have set aside for you. I would just like to start out by saying thank you for all of the education, all of the teaching that you have been doing over the last, I don't even know how many years. It is so very well appreciated. And of anyone that I have had the pleasure of meeting, if anyone actually deserves the title holistic, it would be you.
Mhm, mhm.
Thank you.
Yeah.
So, let's just start out really quickly, if you don't mind, catching people up. You have a book. Yeah.
Yes. Nice.
Path to Pet Wellness, and that is something I was actually just speaking to somebody right before this, recording and talking about how we have somehow gotten into this place where we have a lot of people finding the alternative side of allopathic veterinary medicine, but that paradigm shift isn't happening. So they're still looking at symptoms and asking, instead of what pharmaceutical can I give my pet for the symptom, they're saying, what can I, what holistic supplement can I give my pet for this symptom? And that's where that paradigm shift isn't happening. Like, yes, we're very grateful that you're here, that you're looking at alternatives to allopathic medicine, but we still need to be educating people on that paradigm shift, and I think that's one of the things that you are really, really trying to do.
That is, thank you so much, Jess, for noticing, because we've actually redesigned holistic actions and all the year doing what you just said. So we spent almost a decade now giving lots of information, webinars, and all those unlimited resources that we have that are all framed based on the lens of path to pet wellness. But there's more. And what's more is what you just said is helping them make that paradigm shift. And that, paradigm shift, I mean, there's a reason why the book is divided into three sections, and one of them is making a wise decision.
I
And the
think
first two are what you need to know to make that wise decision.
there. What do you need to know to make that shift? I think one of the questions that we had provided was about the invitation for pet parents to look at symptoms and diseases differently. And I see that in our retail store here. I see the shift happening more and more, which is so encouraging. And I call it an awakening. I had a beautiful conversation yesterday with a woman who only one in her family. She was coming in for help with her three grand dogs who are itching out of control. And here in Texas, in Central Texas, we have oak pollen everywhere and mold as well. And I was proud of her, and I actually just gave her praise and gratitude for coming in instead of running to, her veterinarian, which around here, finding a holistic vet is almost impossible. There are many online. We do have some integrative and some very skilled veterinarians in traditional medicine, and we have some that are open minded. And so I think kind of where the parallel that I'm leading to is information is it's powerful. And if books like yours, you get it into the right hands, and then they can take that knowledge, they can take the courage to talk with their veterinarian. And we encourage ours here to seek out certain veterinarians that are more open minded to the research that the pet parent actually brings to the appointment. So if they end up going into the vet clinic, in this case, we were able to talk to her about various things, and she left a happy woman, not having to go the route of antibiotics and medicated topicals and things that we know are going to destroy, the largest, biome that the pet has, their skin, in addition their gut biome. And then we have a whole other opportunity for a whole other hosts of things to come in. So, I think that, again, going back to the question, you're inviting pet parents to change how they look at symptoms, how they look at diseases, and what how would you explain the core shift that you're wanting them to start making? And how would you encourage them to do that?
Well, first of all, you've said about a bazillion things we could dive deeper into, and I would love to start with what you told your customer because it is an awakening. And I mean, I'm gonna let you guys in on a little secret, and that was the intent behind the book. And in fact, I have a wiki observatory wiki article about how this approach bringing this awakening, and I will be happy to share that link, but you can also just read the book, and that's even better.
Read the
But
book.
first thing I say in the book is that our pets are giving us an SOS. So the first step is recognizing that there's an SOS coming from your animals. What did I mean by an SOS? Significance of symptoms. So what? I'm a molecular biologist by trade. I spent a decade or more actually just doing research and conventional vet med and molecular biology and whatnot. So it all still comes back to me. What are the cells doing? What are they saying? How is the body responding? What do symptoms really mean? Not what is the physiologic trigger for the symptom, but why was there even a physiologic trigger there in the first place? And the answer is the mitochondria. I say mitochondria, and this is the mitochondria theory, goes along with the polyvagal theory because there are a lot of complements. Basically, mitochondria are the powerhouses in the body. And they generate the energy that allows, this is the level, by the way, that veterinarians can understand because it's bigger than the vital force, life force is bigger than mitochondria, but at the mitochondrial level, Janet, you can basically explain that they're itching because the mitochondria are not happy. And how do you make them happy? With all the things that we're going to talk about, because those symptoms are a result of the mitochondrial unhappiness. That's it. If you have no energy in the car, if you have no gas in the car, you're not going to go anywhere. You're not going to function. If you have, diluted gas, you're going to knock. So basically, and that's why it all comes back to food and lifestyle and all that, because it built up our energy and a mitochondrial power. So I would say the answer to how you can couch it or talk to people day to day is just by bringing them back into the now of what that symptom really means, which is that there's an energy and or mitochondrial imbalance.
Mhm. That energy portion is so, I think, I th misunderstood is the first word that comes to mind, I think mainly because kinda something that you started to say before I hit the record button was that we have known for thousands of years what to do, but somewhere along the way, the idea of energy, the idea of frequency, the idea of even the connection that we should have with nature has been kinda made to feel other and woo-woo and mystical and even demonic at times. Like, if you go through the history of it, and I think it's just so misunderstood is probably the best word that I have for it. Pam is very familiar with the energy of it all. I don't know if you have any questions for Dr. Feinman about that part of it.
I know that, the main difference between a holistic vet and a conventional vet is finding addressing the root cause. And I know Dr. Feynman is very passionate about that part of symptoms because we can look at symptoms like you said, but the question I always ask is, but why do they have the symptom?
Right.
And what's the cause behind the symptom? Why is
Right.
the mitochondria not? Why is the immune system, overacting and reacting in a it's out of balance. Something is out of balance. So we have to peel the layers back and go, why? And it's not as hard as people think when you can start to identify like the most common triggers or root causes of things that make things go off the rails. It's not that hard. You don't have to be a rocket scientist to go figure out that certain things are just not good for the body and they will disrupt the vital force. They will disrupt balance and the way the body operates. Maybe you could speak to that a little bit more.
Just that you used the word trigger and cause pretty much interchangeably, and you're right. You were saying it, but it sounds like they're the same, but the triggers are not the cause. The root cause of mitochondria, and I was really astute to notice that, wait a minute, mitochondrial function is not really the root cause. The root cause is the energetic fluctuations that we don't recognize. In the Little Prince, it's a quote that what's essential is invisible to the eye. And that's what we're talking about as far as the root cause. The root cause is what is essential is that energy that's in every air molecule all around us.
Mm-hmm.
And as an energy practitioner, we know from thousands of years of Qigong, all we're doing is we're trying to align with the energy flow all around us. What has happened, Pam, is that the more we get into the weeds, the molecular weeds about this mechanism, and this drug will interfere with this mechanism. The more we do that, the more we get misaligned.
Mm-hmm.
And realigning is the way of what you said, Jess, is the way of the indigenous people. All the indigenous people around the world, they all are better aligned because they recognize the connection, spirit, full life force all around us. That life force is a real thing, and it has real effects, and we can employ it so easily with our animals via the energy of love. It's that love that we share is just, it's incredible. The reason it's a few minutes late today is I was outside playing with Maya, just running around, and that connection is so good for them and for us. So, when we talk about energy, it's really simple. It's really, like you said, it's one simple thing, and that is your root cause. That energy imbalance, that lack of alignment. We can call it alignment with the universe, alignment with the workings of Mother Nature, the greatest doctor that ever was, Dr. Mother Nature, as Gail Pope calls her. Yeah, so what we're really all about here, I think, is how do we fix what we've gotten, the mess that we've gotten ourselves into this time?
Yeah. Yeah. Is this a good time to talk about the happiness protocol and BEAM?
It actually is the perfect time because that's what they do. They help you realign. BEAM is a biomarker. It's actually something we're trying to get into the veterinary curriculum, but behavior, energy, appetite, and mood just happen to be the 4 observable things that will tell you that your pet is out of balance. And you will know by observing BEAM, you'll know before the vet can see anything on tests or x-rays, or we just know when they're off. And the way we know is through the BEAM, the behavior, or maybe their eyes are a little glazed over, maybe like my cat did. The reason I rushed to the doctor with my cat, she did something she hid. She had never hid before in her life. I knew that was it. Her body was telling me it was time for us to pull out old stuff. So yeah. So that BEAM is a biomarker. But BEAM, let's talk about, I just spoke with Debbie in Bermuda a little while ago, and Scupper's BEAM dropped to a 7, whereas it had been a 9 out of 10. Sorry, it's 1 to 10, where 1 is really not so good and 10 is the best. It had been a 9. The dog lives in Bermuda, swims, runs around happy all the time, has a great lifestyle. But he developed the disease and it's on a bunch of drugs. When she started giving At the energetic homeopathic medicine, the beam started rising, the blood count started stabilizing, but then she stopped it, and his beam of 9 dropped back down to a beam of 7. So our conversation today is how do we get that beam of 7 back up, and then begin to wean the drugs a little bit, mindfully wean the drugs a little bit. So the happiness protocol is 3 steps. 1, and again, it's all about awakening and consciousness and staying alert and knowing what's around you. But number 1, what does your pet love the most? What did they love the most throughout life? It might be a food, it might be playing, it might be just petting and purring. Number 2, do more of that. Whatever you're doing, because we're all, petting and playing and what, but double it. If your pet is really sick, double the amount of time you should go outside, even if it's 3 to 5 minute micro exposures. Sorry, my body is choking right now.
Are you okay?
I'm fine, thank you. My brain doesn't communicate well with my muscles of swallowing all the time, so
Oh.
I sometimes just choke on my own. Yeah, anyway, so double it. And if it's playing, if it's going outside, if it's a kitty that really wants to go out, but you're not able to let them out, and you got sick because they're not going out, you can try to let them out, play with them. And number 3 is evaluate. Just within 2 weeks, evaluate the effect, because I virtually, I'll say 99% of the time, you can see the symptom, the energetic symptom resolve. So when you practice the happiness protocol, it helps to increase beam and get rid of symptoms. What do I mean by getting rid of symptoms? I will go into that because I better be quiet now. Sorry. Don't even know if I answered your question, Janet. I hope I did.
Yeah, well, I think that one, I want to say, since the last time we spoke, the beam questions have been something that I have used with my pets, especially, and I will admit I haven't always been good at it, but I always remember it when it's that time where at the end of their life where I'm making these decisions and I'm questioning myself. I'm like, this is a way that I can get out of my head and actually look at my pet. But so I appreciate that you have that out there for people, to utilize as a framework to really get them kind of back into, like, what is actually going on with their pet. I know, like, side note, when I talk to people, a lot of times I have people come to me looking for answers for help with their pets, and they bring me all of this data, all of these, blood tests and all of this information, and they're like, I need to get their ranges back, where they're supposed to be. And I'm like, my first question is always, okay, but how is your dog?
Mhm.
Right? Like, it's really easy to get caught up in
The numbers.
their liver values are higher than they should be, or their kidney values are high, or whatever is going on. I'm like, okay, but actually, how is your dog? And I think it seems so simple, but we forget about it.
We sure do, and that is the one fundamental shift, perhaps, that we need to make is away from focusing on symptoms versus quality of life. 'Cause symptoms are external and internal, so those liver value elevations are symptoms. They're just internal symptoms. Pain is just an external symptom that happens to reflect, quality of life. It's actually 4 separate symptoms that you can all grade separately, but so yeah, thank you, Jess, for thinking about that, remembering about that, and now my own doctor actually asks me when I first go back for recheck how should be.
That's awesome. One of the things that I have been really trying to focus on lately, especially, I mean, I'm forever a student, right? Like, there's never a point in time where I'm gonna say, "Oh, I know that." Like, no, I don't. I know what I know, but I know that there's other things I don't know.
Mhm.
And one of the things I've really been trying to focus on a lot lately is the, like, really, really fundamental things that we all take for granted: light, air quality, water quality, just, circadian rhythms, connection to the earth, grounded, like these things that
Yes.
most of us do not think about on a day to day basis, but have huge impacts on our health. And what I have been thinking as I'm listening to you talk is that if we were to actually get out of our own way and let our dog be a dog and let our cat be a cat and let them show us what they want to do, how they want to interact, how much time they want to be outside, like all of the things, that we could really learn a lot. Not just on how to better care for them, but honestly how to better care for ourselves. And I think that might be some of the, like, foundational principles of what I'm expecting to hear in a lot of your work.
And that is, and you're right, and that brings back to the awakening because our animals are, as Eckhart Tolle says, they are the perfect gateway for our awakening.
Mhm.
And the way to do that is just what you said, let your dog be a dog and get into the dog space. Your cat be a cat and get into the cat because they're not worried about the future. They're not worried about the past. No, they're in the now. And like you said, getting out of the head is the hardest problem. Is getting us out of our heads. When this approach began, we called it embodied veterinary spirituality because being in the body is certainly one way of getting out of your head. Eckhart says we all need to come to our senses. And in a way that's exactly right. I mean, we just need to be aware of what's going on around us. And that's why you'll see that the path talks about the C3 movement. We can blow things up with C4 and ignite things and blow them up, but we can blow up the world with C3. And C3 is conscious, compassionate communication.
I like that. That's
Tom,
true.
we are all now officially part of that C3 movement, and we're going to blow up the world with that.
In a positive way. I like that. That's, yeah, love, which is the highest energy, right, Pam?
Yeah. Yeah.
Yeah.
Exactly.
You brought up the I Jessica, what you were talking about, I equate to being in nature, and you have the natural sunlight, which has been demonized, and we are told to put sunscreen on, which is cancer causing. I'm sorry, I'm just going to say it. Um, yeah, and my husband and I were outside with the 5 dogs this Sunday, and I love being outside in the backyard, as much sun as I can get. And I'll tell you, since I've started doing that again and going out barefooted and feeling the grass and connecting with the earth, standing against a tree, just lying in the grass, lying in a hammock, letting my dogs come and go. It's always interesting to see how they'll gravitate to me the more grounded. I'm not going to say calmer, but grounding creates a sense of peace and calm. Which I'm not a molecular scientist or a biologist or anything like that. However, I know that's got to have a positive benefit at a mitochondrial cellular level. And so I think it's interesting because his comment was, well, I need sunscreen. And I said, you absolutely do not. And we do not have any in the house. So just soak up the sunshine. And then Dr. Feinman, you talk about the 5 senses, and it just keeps coming. The word that keeps coming to my spirit is nature. And like you said, let a dog be a dog, let a cat be a cat. And we've been taught and conditioned to almost live in this bubble
It's
with
reality.
all these manufactured um, everything, sprays,
Yeah.
perfumes, deodorizers. Your laundry's not clean unless it smells like, a field of sunflowers, but it's contrived. And I think contrived is the word, and that just has created this sick model and all the sickness and disease, and getting back to nature, five senses, simplicity, and exactly where your studies have taken, your life has taken you, Dr. Feinman. I think that it's an exciting time. I like your C3. I think that our listeners could grasp onto the C3, and that I see that as an explosion of health and positivity and love and balance and calm and just whole. And so I'm excited to read your book. And I just wanted to connect that for everybody. That's how it connected with me. But I would love to hear a story about one of your cases, if you will, where you applied the principles that you're teaching and you're writing about.
If you're here, it's because your pet isn't just a pet. They're family. And you can feel when something's off, even if the labs look normal. That's why I created Wild Wellness Pet and the Wild Wellness Bioenergetic Test, to help you see the hidden stressors your pet's body is quietly carrying and give you a clear, holistic starting point. Head to wildwellnesspet.com to explore the bioenergetic test and the apothecary, and take the next loving, protective, proactive step for your pet's healing journey.
I would love to hear a story about one of your cases, if you will, where you applied the principles that you're teaching and you're writing about.
I'm chuckling because I literally just submitted an article about that, and you will see it come out soon. Can I use that example?
Sure.
That'd be all right, because it's
Sure.
Maya. It's like last week we spend all day. I'm not going to show you right now, but she's right there. We spend all day really in the office, and so we're pretty close. But she started squinting last week, and then by midday, it was actually before lunch, her eyes were held tightly closed, and then she started pointing at them. I said, "Oh, it's a bad acute account." She was in daycare 2 days before that. Not that that's at all related. So what was my first, all right, my first response was panic. It's like, oh no, she's going to scratch her eye, or, and make it worse. The first response was just what you said, Jenna, was to go outside. And outside, played for 3-5 minutes. Her eyes were totally better, all gone. Came inside, it came back. That was a clue that her body was giving me that, no, going outside was great, but and I was able to use that very, very specific clue in the homeopathic parlance. It's called a modality. A modality is what modifies, our environment, what can cause a symptom or trigger a symptom to come on or get better or get worse. In this case, it was coming inside, was making her eyes work. She got a remedy, a homeopathic remedy. That was the intervention, also from the book, and she got all better. But then later in the day, her eyes turned beet red. Even when she was squinting and pointing at them, they weren't beet red. It actually looked like she was bleeding into her eyes. Like if you open the eye, pry the eyelid open, it looked like there was just blood back there. That was her body telling me that there was something different going on, meaning that it was the same thing, but I approached it the wrong way, so I used a different remedy. The redness was gone by the time we woke up in the morning, because she went to sleep right after that. By the morning, she was fine. So that was happiness, nature, modality, homeopathy, all combined in one, and saved myself around $1,000 going to the ER.
Mm-hmm. Yeah.
But I will say that if that squinting had continued, if, I didn't like the way she looked, I would have gone right away for an eye stain and, all the conventional ERs. And that really is how I think you get the best of both worlds. You get empowered with the information that there's another way to look at it than what they did at Cornell. When I first had this theory about vitality and balance, which is really what we're talking about, building up vitality and balancing it. Set that theory, I went to Cornell, which is right here in Stanford, Cornell University vet specialist, and talked to their head internist. He said the framework is great, it's wonderful, but what do you do with it? So those words, what do you do with it, inspired me to figure out what you do with it, and what you do with this is what we're talking about right now.
That's
So
awesome.
Mhm.
Awesome. Do either of you have a question, girls?
I can always talk. That's I'm trying to give you guys a chance to talk.
I feel like I'm
No.
asking all the questions. I have 2 more, but
Yeah.
yeah.
Yeah, I was going through some of these, kind of changing channels a little bit. Since changing the pet parent's mindset is really part of this whole transition into a different paradigm of thinking, when how would you coach pet parents, or what would you tell them that they can ask their vet if like a lot of times, they go to a vet's office and they have 5 minutes to meet with you, or whatever. It's a very short period of time. And there's not a whole lot of time to talk into deeper issues or conversations. And a lot of pet parents just feel overwhelmed and they feel pressured and rushed. But I think a lot of them would really like to know how to ask questions to slow things down and make it like, talk to me like a layperson instead of a doctor with your lingo and terminology and all this. What kind of guidance would you give pet parents to help them make those appointments the most effective and helpful for them?
I'm so glad you asked that question, Pam, because I have a whole handout on that, and it's based on C3. It's based on using conscious compassionate communication with your vet. And the reason I'm doing this right now is a lot of people are missing this. At the end of the preface is that QR code. Scan the QR code, gets you all of the extra resources that go along with the book, one of which is the handout about how to get these answers from your vet. I think that it comes down to the individual pet parent, and are they empowered? Because a lot of us can go to the vet and the vet spews all the stuff at us and we say thank you and leave and then
We don't ask
decide what to
questions.
do.
Yeah.
But if you have a vet where you have to do what they say right away and act right away, then it may be time to find a new vet. Because you need a vet that's respectful, that's not, going to be based on it's my way or the highway. 'Cause having an open mind is the basis of science. And a veterinarian is supposed to be a scientist. Science is not molecular biology, it's not veterinary medicine. Scientists finding rules for things that are reproducible and teachable.
Yep.
That's it. Ask your vet. No, tell me exactly. Don't. I just say, okay, good. No, we need to get that antibiotic. And then I go home and decide what to do.
I think this topic has become even more difficult for pet parents to tackle since so much of veterinary medicine has become corporatized, and most people
Yeah.
today, I would be willing to bet, don't see the same doctor for their pet each time they go in, and so there aren't relationships being built, and that just makes things so much more difficult.
For sure.
Yeah, and those relationships, that connection is exactly what the different vet that you see every time. They don't know your animal. You know your animal better than any veterinarian, and I do implore people, even if they're in a huge corporate practice, to request the same veterinarian each time. You can ask. They're not going to
Yes.
give it to you if you don't ask.
I'm so glad you said that you brought that up, Jessica, and Dr. Feinman. Your answer is ask. And it is about empowerment. And, we try to convey to our community that you are your pet's advocate. You're their voice. They don't have one. Now they present with quote unquote problems, but you are doing the speaking for them. And they're so susceptible just as we are as, humans. And I think, again, the awakening, I think we're seeing more and more people questioning things, which questioning is always good.
Mhm.
Questioning is how we discover. And what'd you say, Pam?
Learn.
Learn. Yes, we
Mhm.
discover, we learn,
Mhm.
and we improve, hopefully, because it goes back to the old, saying about if you always do what you've always done, you're always going to get what you always got. And if it were working, no matter if you're in a corporate veterinary environment, which I think now statistically speaking, it's 75% of all veterinary clinics are corporate owned because private equity money has discovered that, we can create a funnel and a script and a process for everything, and we can monetize it. It's disgusting.
But it's the way of the world, and
It is the way of the world, but we're talking to the disruptors.
Well, that's where I was going with that. It's the way of the world, but we know there's a better and different way. But what we're talking about fundamentally is the corporate mindset and point of view, the money, 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 or the
Yes.
kinship worldview. What is the kinship worldview? The kinship worldview is the same worldview that the Native Americans, First Nation, Aboriginal, they all share. It's all that we're all kin. We're all related. We're all connected by that energy of love. And there's a fantastic book called Restoring the Kinship Worldview. It's a bunch of scientists from all around the world just putting it all together in the way that we could restore that and maybe still have corporate America, just not the divide getting bigger and bigger and bigger the way it is right now.
Yeah.
And you're right. I mean, you're 100% right. It's going to come from the pet parents. It's not going to come from the veterinary. The veterinary model works. It's working. It's getting rid of symptoms and making money.
Yeah.
So what more can you ask?
Yeah. It's when it comes back, if that we're working well, the things would not keep coming back. And I think going back to what can pet parents do differently in order to get a different result and hopefully a better result. I like the 3 C's. And so they can help guide that conversation by taking the tools that, you're teaching them and you're providing in your book. They can take that and apply it to their appointments. And I would be willing to bet they'd get a completely different experience and outcome.
And I would agree. And even they're thinking about this before the visit is going to change the outcome because the energetic vibration is going to be different on their end. Yeah.
Mm-hmm.
However, and you know this better than I am sure, most vets are overwhelmed.
Yes.
They've got information. We graduate, our heads are full, and we're just going to do what we have to do to pay back our student loans. And yeah, more and more clinics are now becoming corporatized, but you still can find, right down the road from me is a mom and pop, actually it's just pop, but it services, the whole area, and he's just a non-corporate veterinarian. So yeah, we have a great article on holistic actions on choosing your veterinarian, talk to your vet, and so I think it's holisticactions.com just /select. How to select a holistic veterinarian. And that's holistic, bringing us back to the conversation that we started with. That's what holistic with an H doesn't necessarily mean they're a holistic veterinarian with a W.
That's so true. That is so true.
Because Jess or whoever said that we're getting rid of symptoms with supplements and foods in lieu of drugs. Well, that's the holistic way. But the holistic way is we've adopted this other energetic paradigm that we're talking about.
I want to ask something totally different, if you don't mind. This is not a question we sent to you, but since it came up, I'm curious. I'm genuinely curious your thought on this, because you said the current veterinary model is working, and as far as privatized investment and corporations are concerned, it is working. Like you said, they're suppressing the symptoms and they're making money, and the dogs and the cats keep coming right back in because we're just suppressing the symptoms and they just keep making money. But where my mind went with this, and it is working right now, I totally agree with you. My mind went with this just since the introduction of kibble. We have seen in some breeds their lifespan is half of what it used to be before the introduction of kibble. And I'm just calling out kibble, even though there's so many other factors, vaccines and toxins in the environment, like all the things. There are so many factors, but that is a statistic that we can actually look at. Like cancer rates are astronomical, and lifespan is drastically shortened. And if it continues this way, then I think it's no longer going to be a profitable model, because the model is to keep them sick, because then they keep coming back. But if we're killing them, that's not a profitable model.
Span gets shorter and shorter.
Yeah. I'm just curious your thought on that. Oh, you're muted.
Oh, audio. My head went somewhere totally different when you just brought that up, Jessica, and I'm just going to hold that for an off-camera conversation.
Oh, no, I want to hear it. But what I said was when you use the wrong metric, you get the wrong answer.
Yeah.
And if we're using the metric of getting rid of symptoms, then yeah, we already have lifespans reducing, chronic disease rise. I mean, it's so freaking clear. I mean, I gave a talk at a big training center about a decade ago. The owner of the center worked for a Newfoundland dog, breeder back in the 50s. Big dogs that lived now, 8, 9, 10?
Crazy.
They were 17, 18 routinely, and this is the argument, they ate that same kibble, but they also had a mixture of fresh foods. I think that's key right there, is we're building up the vitamin vitality, the vitality that we need to survive, that's in fresh food, but not in processed food. That's reality. Kibble happens to be the lowest level. Well, no, it used to be what I called the lowest level. Now I call hydrolyzed foods the lowest level.
That's a good point.
Of devitalized foods, yeah. They're not readily available, but they're there, and there are more and more. Debbie in Bermuda was feeding a hydrolyzed food because they think he may have IBD. But anyway, processed food, kibble, hydrolyzed food, fresh food. We know there's a direct correlation between the more processed food you eat as a person or an animal, the sicker you get. The more recurrent issues you get. And I don't think, Jess, we're going to get to the point in our lifetimes where we're going to reach the point of diminishing returns, where the corp model is going to realize that maybe there's another model out there. But what is happening are places like Mars seeing that pet parents are really starting to feed fresh food. So what was their first step? Buy up a fresh food manufacturer.
Yes.
Great. I mean, if we can get them behind this, that's all we need really, is one billionaire to fund a project like this. We could change, vet med, because it all really comes down to funding, and we don't get funding to do the studies to prove that what we're talking about is real, because the companies that give us the funding have decided that there's some other model that's better, and that is the model of drugs. Yeah.
Well, I know on that topic, and Pam remind me to talk to you about this later because Ryan Yamka and Farmer's Dog recently published a paper
Yes.
on fresh food versus extruded, showing the benefit. That's very, very recent. That just happened. So that's a win, even though I may not be the hugest fan of Farmer's Dog, but it's a win.
Yeah. It's a step in the right direction towards fresh feeding.
Exactly. I mean, a decade ago, if you went to your vet and you talked about fresh food feeding, you might have been kicked out of the practice because it was so far from, the prescription diets. But now it's very, very, very common and growing. Whether it's cooked or raw, there's just so many ways to do it. And I'm sorry, but that nutritional stuff is all great info, but that complexity is bringing us further and further from the simplicity of alignment.
It is. And for me, any path a pet parent finds to come to what are the original modalities, but are considered now alternative modalities, I would hope there are enough of us to welcome those people into whatever lane they are coming over in, whether it's nutrition or supplements or, no-sodes instead of vaccine or whatever it may be. That there are enough of us to be able to talk about any of these different modalities to help their pets and continue to convert them over onto, I don't want to say our side, but it seems like it's our side sometimes.
Reality. Bring them back into the now. Bring them back into because the answer, Janet, to how do you get that person change when they see the change in their animals, when they see the reality of what happens when they practice the happiness protocol for 2 weeks. It's like, wait a minute, stop itching. I don't get it. But you can explain that there is a science-backed framework behind this, but it doesn't matter. Just do it. I guess that's my advice. Just do it.
Just do.
Pam, Janet, do either of you have any other questions that you want to ask Dr. Feinman?
I have one last question, but Pam, do you want to go first? Mine is geared toward the veterinary community.
Yeah, go for it. We might have the same one.
Okay. It's just regarding, those that have chosen what I consider a noble path, caring for pets. So practitioners, veterinarians as well, if they're listening and they're feeling that pull and the tug towards going towards a more integrative or even holistic path, what one courageous first step would you recommend that they take? What's your advice?
The answer is going to be very unsatisfying to you because the answer is it depends. Depends on what is that individual willing to read a book. If they're willing to read a book, then I would say read, Don Hamilton about homeopathy or anything that expands their current knowledge base. That read the new book by the neurosurgeon. It's not even that new anymore, but he had a 1-week coma where he was brain dead, but he remembered the whole thing, and then goes into explaining why it's all related to alignment, and that the more we align with the reality of life and the afterlife, the better we can make decisions. So the one thing I would say will depend on the individual. Most of the people I'd say read a book. There are books like Kent's Lectures on Homeopathic Philosophy. Very, very easy to read, and it gives you a whole new perspective on health and life. Or go way down, if they're not able to do anything, then all we ask is to open their minds a little bit. Just do what you said at the beginning and ask. Just ask that question. Kindle that natural curiosity that drove many of us to be veterinarians in the first place. Because we were naturally curious about why our animals did what they did or why life was the way it was.
Thank you.
That's probably a really great thought to end on.
And I agree. Yeah, I was
Be
gonna.
open-minded.
Yeah.
Yes, be open-minded. Well, Dr. Feinman, can you show us your book one more time?
Sure, and
And
I'd
tell us
love
where it's available.
anywhere you buy books.
Okay.
Yeah.
If you go to
Love it.
if you go to holisticactions.com/book, it'll give you a bunch of different options. And then scan that QR code. We have 10 hours of video diving deeper into the book with people from around the world. There's a guide to what you can do with your vet, a ton of other things. But Janet, I also wanted to read the quote that begins. There's a bunch of quotes in the book. The quote that begins the book: "We cannot solve our problems with the same thinking we used when we created them."
Yes.
And who said that?
Yes.
That was Einstein said that.
Awesome.
Sure.
That's perfect.
Thank you so
Perfect. Yes, Dr. Feinman, we appreciate you so very much. I'm so looking forward to reading this book. My TBR pile is large, I'm not gonna lie, but I definitely it's going closer to the top because
Yes.
Thank you.
it's definitely for me triggering something that has been kind of swirling around in my brain for the past couple of months anyway, and that is that reconnection with nature. And it's certainly been adjusting the people I bring on the podcast and the things that I talk about, and I've been in this like phase of kind of remolding the education that I'm even putting out, and that's kind of where I've been going. So I appreciate you so very much. Thank you for being here with us today. And holisticactions.com, where you can find everything, holisticactions.com/book. If you want to go directly to how you can find the book. So thank you so much.
Thank you.
Thank
An
you.
awesome.
Thank you, Dr. Feynman.
Great to see y'all.
All
Have
right,
a
guys, give your
blessed day.
pets some extra love from all of us this week, and we will talk to you next time.
Sounds good.
Have a blessed.
Before you go, if today's episode got you thinking about what's really going on beneath the surface for your pet, don't forget to check out wildwellnesspet.com. You'll find the Wild Wellness Bioenergetic Test to help uncover hidden stressors, plus a curated apothecary of holistic remedies to support true root cause healing. Visit wildwellnesspet.com to start building a calmer, more vibrant pet from the inside out.